From the seventh floor, second time.
Thank you, Mr. President. We don't require the reading of a script when somebody wants to get a vasectomy. We don't require the man to come in and have to sit down with the doctor and say, the state says I have to read this to you now. And the state does not require that man to be patted on the head and say, you go home, you think about this for 24 hours. This is a real big decision, fella. We're not sure you're up for it, you know. I know what you want. The state has other ideas. State knows better. You think about it for 24 hours, and if you still feel up for it, you come on back. And we also don't require the reading of medically false information, medically dubious information. We also don't require a forced ultrasound for men that does nothing. That's something that passed here through this body, the old forced ultrasounds. We also don't require shifting gears here. We also don't require even any waiting period at all to buy a gun. So you want a gun? You go ahead. Here you go. Used to be a 48-hour waiting period. Now there's none. You know, somebody could come in and be all hot-headed, find out about something, and God, my gosh, they need that gun right then and there. You go ahead, you give it to them. The state doesn't require any waiting period at all. You pass a background check if you buy it in there in a store. Heck, if you don't pass it there, you just go online. So we don't have universal background checks in the state of Wisconsin. But this takes it again a step further of going down the path where I get that there is an effort to try and outlaw all abortions. To say the 1/3 of women who have had an abortion in their lifetime, well, they should be locked up, they should be penalized, and that the doctors that perform a routine medical procedure, well, they should be outlawed too. They should be locked up too. And I get that maybe coming out and saying that isn't in vogue right now, but that sure as heck seems where things have been heading and where things are heading across the country. So we have these bills that are coming up today stuffed into these four bills, stuffed into this Trojan horse of saying, oh, we care about life. If we cared about life, we would have expanded Badger Care 8 years ago. If we cared about life, we'd make health care more affordable. If we cared about life, we would make sure that we have time off for the parents, paid, to make sure that they can bring up that child in a healthy environment. We would make sure we have affordable child care, right? We would invest in quality public education instead of defunding it. So this is just getting at a small piece of where we're actually going, and I'd say, look, I appreciate your tenacity. I wish you had this much tenacity when it came to actually tackling things that do have a detrimental effect on our neighbors' lives. But the real giveaway in this bill is the list. We haven't talked about that yet. The list. You guys want a list of where abortions are performed in the state of Wisconsin. You want to have a list, you want it made public. What the heck does that have to do with protecting a woman? What the heck does that have to do with protecting anybody other than making it that much easier for protesters and the domestic terrorists that hide in their midst to attack doctors, to attack women, to harass women, to make it easier, that you have a checklist that you can just hand out and say, here it is. Here's where abortions have been performed, here's the places that they've been performed, and here's how many there are. Thank goodness this will be vetoed, thank goodness this will be shut down, but this is a pretty despotic future that you are outlining for us. And, it's completely divorced from the reality of what people actually want to see. Recent Gallup poll puts the number at 79%. 79% of the American population supports legal access to abortion. 79%. And yet here we are, spending time on this, wasting time on this, when there are so many other things that we could be doing. If we cared about preserving life. It would be about making sure that we are expanding access to health care, making it more affordable instead of turning people away if they don't have the right income. So we get it. We get the bills that you're trying to pass. They're all going to be vetoed. They're all going to be shut down. But we can see it. This may be the things that you're trying to push here, but we see what's happening across the country, where they're putting bounties on women now, bounties on people who are looking to help those women to be able to access this. You know, where women are denied, or in some case girls. 12-year-old girl down in Texas wanted to get an abortion. They said, nope, you're not allowed. Right? Just to make it that much harder for people to access something that is constitutionally protected, right? Autonomy over their own body. So, count me out on this one. Count me out on the next ones. If you want to work together on something to make sure that we are actually increasing access to health care and something that's going to increase quality of life of folks, let's go for it. The senator from the 26th outlined a whole host of bills that are on the table right now. Let's get those things done. We have plenty of time in the session to have hearings. We could hold hands on that one and celebrate as we pass that one through, because it would actually benefit all of our neighbors, and it has the benefit of having a heck of a lot more support than these.
Senator from the 4th.
Thank you, Mr. President.